All right, we'll go ahead and get started. Hi, everyone. Thanks so much for being here today for our July community conversations, where we're focusing on the services that we provide to critical access hospitals, rural health clinics, and we also have some population health program updates for you as well. So I'm joined here today. I'm Sarah Anderson. I'm the Director of Field Services at the Oregon Office of Rural Health. And I'm joined here today by Stephanie Saig, who is a Program Manager for Critical Access Hospital Quality Improvement. Rondi Ann Gerst, who is going to keep her camera off because of internet issues. She is our program manager for rural health clinics. And Stefa Dragoon, who is our program manager for population health. Before we get started, just a couple of quick things. Please make sure that you're muted while the presentation's going on, but feel free to unmute when we get to the point of question and answer period. You can also put your questions in the chat as we go along, and we'll make sure to answer those questions as we go along today. Also, we have a couple of two more community conversations remaining for the year. We do this on a bi-monthly basis. We have done, let's see, three others besides this one this year so far. September 18th, our healthcare workforce team is going to talk about students and healthcare workforce pipeline and pathways programs. And on November 20th at noon, we are going to celebrate National Rural Health Day and bringing in some perspectives on rural health from hospitals, clinics, communities, etc., as we celebrate National Rural Health Day, which is actually November 20th as well. So you can register for those community conversations at the link on the screen, and Sarah is going to put that link in the chat in just a moment as well. Also, just a quick reminder that we have our Oregon Rural Health Conference coming up October 1st through the 3rd in Bend. Registration is open and the agenda is available on our website, and Sarah will put that link in the chat as well. So today we're going to orient you to our field services team, which provides the technical assistance and education programs to our rural health facilities. Stephanie is going to talk about our small hospital improvement program, as well as our quality improvement activities. I'll talk about the critical access hospital support we provide in terms of financial and operational improvement through our FLEX program, as well as our data and reports. And Rondi Ann will talk about our RHC programs. And finally, Stefa will discuss our population health programs. So first, I want to orient you a little bit to our team. So the Oregon Office of Rural Health Field Services team is made up of 6 individuals who each have expertise in rural health facility and EMS agency finance and operations, compliance, quality improvement, population health, and data and analysis. And our goal is to assist Oregon's rural communities in piloting, developing, and improving evidence-based healthcare delivery systems to maintain access to quality healthcare in the state of Oregon. The team also helps to increase the rural voice in state decision-making. And our primary strategies to accomplish these goals are providing education, technical assistance, and mini grants to support rural health initiatives across the state. As we go through today's presentation, we'll outline in more detail how we support Oregon's rural communities and their critical access hospitals, rural health clinics, and EMS agencies. So before we get into our program specifics, I'd like to say a few words about our funding. The majority of our field services team programs are supported by federal funds through the Federal Office of Rural Health Policy, which is in HRSA within the Department of Health and Human Services. And these grants include the State Office of Rural Health Grant, the Medicare Rural Hospital Flexibility or FLEX grant, and the Small Hospital Improvement Program or SHIP grant. And each of these grants is critical to our ability to partner with and assist Oregon's critical access hospitals, rural health clinics, and EMS agencies in meeting their community's healthcare needs. So as we all know, we're facing unprecedented times regarding federal funding, and while our programs are funded through June 2026, they're all zeroed out in the president's fiscal year 26 budget, which is a proposal that he provides to Congress as guidelines for how he wants to see things funded. Congress is in the process of setting their appropriations for fiscal year 2026. And it sounds like in September, they're going to be discussing the Health and Human Services budget items that we fall under. So if they don't appropriate funding at least our current levels in 2026, we aren't going to be able to continue to provide the same services we do today. So if you're interested in learning more about how you can educate your legislators about the importance of state offices of rural health and the programs we're going to discuss today, please email me. And Sarah, if you don't mind putting my email address in the chat. And then I will also, after I'm done talking, put a link in for the National Rural Health Association, as that organization has some easy ways for you to engage. So that said, I'll discuss our current funding. So there are 45 flex programs across the US, and each program is allocated funding based on the number of critical access hospitals in the state. In Oregon, we receive about $800,000 a year and receive those funds in 5-year cycles. Our most current cycle is from September 1st, 2024 through August 31st, 2029, but it's contingent on annual appropriations from Congress, which is why I mentioned the fiscal year 26 impacts earlier. Through our FLEX program, we provide technical assistance and educational programs to rural health facilities and agencies, such as assisting the state's 25 critical access hospitals and 97 rural health clinics with their quality reporting and improvement initiatives and financial and operational improvement strategies. We also support population health through a grant program and our Forum on Rural Population Health. And training and supporting rural community health workers all fall under our population health programming, which Stefa will discuss a little later. This year, we were also awarded a 5-year grant to focus on rural EMS recruitment and retention activities through the FLEX program. So those activities provide things such as scholarships for folks who want to become rural EMTs, training for community paramedicine or mobile integrated health, and more. We did a webinar on this program back in March, and if you go to the community conversations link that was first up in the chat, you'll be able to view a recording of that. We also administer the Small Hospital Improvement Program, or SHIP, to small rural hospitals with 25 beds or less. And this grant, which Stephanie will discuss in a moment, is a pass-through grant for hospitals. And each year, hospitals apply for the grant and receive around $11,000 to work on training projects focused on quality improvement and reporting activities, accountable care organizations, and shared saving programs, as well as payment bundling or prospective payment systems. So these funds are combined with the flex funds at the federal level, so the appropriation for SHIP is included with the flex appropriation that I referenced earlier. So now, after I've set the stage, I'll turn it over to Stephanie to discuss SHIP further, as well as our quality improvement programs offered through the FLEX program.
Fantastic. Thanks, Sarah. Can you go ahead and change slides? And one more. All right, perfect. Thank you. So as, nope, one back.
Oh, sorry.
Sorry. As Sarah mentioned, SHIP is from the Federal Office of Rural Health Policy. It is non-competitive, and we make it available to the 25 Oregon critical access hospitals, which on this map you'll see are in red, as well as 6 rural PPS hospital or prospective payment hospitals, and those are in blue. So these funds are awarded annually, provided the federal funding continues, knock on wood. All right, go ahead and change to the next slide for me, please. So as Sarah mentioned, there are 3 investment categories for eligible expenses under SHIP. One is value-based payment, which is essentially quality improvement initiatives. And then the accountable care organization or shared savings investment activity is really more for things like pharmacy services, population health initiatives, systems performance training, that sort of stuff. And then third, the investment category for payment bundling and prospective payment systems really is more financial and operationally focused. So activities around cost report training, charge master reviews, revenue cycle management, and pricing transparency. So the software, website development and maintenance. Those are the types of initiatives that hospitals can undertake under SHIP that are eligible. So our grant year for FY25 kicked off June 1st. It'll go through the end of May. Each hospital, as Sarah mentioned, a little bit more than 11,000 this year, so $11,138. Hospitals submit their applications for this grant in December, and they can choose to either do their own independent grant opportunity or a project that is under those allowable investment categories, or they could work with one of the 4 vendors that we have listed here. The benefit of using a vendor is that it reduces the administrative burden for the hospitals under SHIP, and they provide the training and expertise in any of those areas that we talked about. Specifically, this year we have a vendor for quality improvement, one that helps with implementing simulations, and then the other 2 are more focused on the finance and operations side of things. Next slide. So I'm going to pivot and talk with you guys about quality improvement specific to critical access hospitals. Quality improvement is so very important with everything that we do, and it's truly one of those things that we want to really work to support critical access hospitals to do throughout Oregon. So I focus specifically on the quality improvement initiatives funded through the Flex grant. Our office provides support and resources to the critical access hospitals, and we focus on a specific subset of measures that we call the Medicare Beneficiary Quality Improvement Project, or MBQIP. These measures really often tie in with CMS reporting programs. And the reason that we try and do that is to lessen the burden for the critical access hospitals. And then these measures that have been identified by the Federal Office of Rural Health Policy are to support cause as the healthcare industry moves more from a volume to value type of a model. And so in times where critical access hospitals by CMS's guidance really aren't required to report, these measures are directly tied to the Flex and SHIP programs. Next slide. So I'm going to show you the measures. If they come through in just a minute, there they are. All right, so these are dun, 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 the MBQIP measures. They fall under 5 domains. 3 of these measures are reported quarterly. So that's the patient satisfaction surveys, the HCAHPS, emergency department transfer communication, which is unique to critical access hospitals, and then the median time from ED arrival to ED departure, which is also known as OP18. The remaining 8 measures are reported annually. The ones that you see in orange are newer to all of us that are working with critical access hospitals and quality across the nation. And I will say that 2 of the 8 that are social drivers of health are proposed for removal, and we're waiting to see what that looks like at the end of August. So these are the measures when we talk about MBQIP, this is what we're talking about. Next slide, please. So now I'm going to talk about some of the current grant activities that the Office of Rural Health offers for critical access hospitals under the Flex grant. Antimicrobial stewardship is incredibly important, and we've done a variety of different things to support hospitals. This year, we are working with Intermountain Health to provide some one-on-one technical assistance, and we have both Blue Mountain and Grand Ronde taking advantage of this initiative, and they provide virtual education and access to infectious disease experts. So that's a really amazing opportunity that we're looking to continue. And then Sarah put inside the chat the CAH quality and reporting guide. Each year this gets updated, and Stratus Health is the vendor that helps us to do this, along with a variety of other states. It's a cross-state initiative. And this really helps critical access hospitals to crosswalk the measures that they need to report through MBQIP and other reporting programs. And then we provide an MBQuip monthly newsletter with announcements that's published by the Rural Quality Improvement Technical Assistance Team under the Federal Office of Rural Health Policy. Next slide. So one of the opportunities that we have is we do every year we change. So CAH Quality 101 and turning data into improvement, we rotate and do one year and one the next year. And we work with Susan Runyon from Runyon Healthcare Quality Consulting. She provides the one-on-one in a virtual format. And we have the turning data into improvement as an in-person opportunity. But both of these really dive into how to improve measures and can get into some of the more specific challenges that each hospital may have when looking at these measures. And then Sarah's also put into the chat links to the slides that we have for the variety of presenters for our Oregon CAH Quality and MBQuip workshop. Each year we provide that annually. And this year it was in Seaside in May. And it was a great opportunity and a great chance for quality improvement experts from around the state from different CAHs to connect with one another and share information. And we also offer certified professionals in healthcare quality, which is professional development opportunity that gives CAH quality directors a chance to prep for the CPHQ exam and also sit for the exam. And then my last slide, if you would be so kind. I'm going to just go through the remaining activities that we're providing for CAHs under the Flex grant. We have the Oregon CAH Quality Network. We do this every month. It's a chance for critical access hospital quality folks to get together and share any challenges that they might be having, any unique opportunities, any questions with one another. It's a really great informal opportunity to connect and share. We have a current social drivers of health cohort that focuses on patient and family engagement perspectives. And this is led by Susan Runyon. We've got some one-on-one technical assistance, so hospital-specific opportunities, in addition to virtual trainings as a group. So that's been really fun. And then also Sarah put into the chat the Oregon Rural Health Excellence Award. And this is my big plug for you guys. We have until August 31st to get in any applications. And it's an amazing opportunity to recognize critical access hospitals, rural health clinics, EMS, and community-based organizations for the amazing work that you're doing. It's a great opportunity to highlight everything that you do and showcase it for the state. It's a really good chance to just bring light to the amazing stuff that's going on in Oregon. So I highly encourage, if you haven't already, please apply. And the folks that get selected will be able to get a travel scholarship to go to our annual conference so you can share the award with the crew. And then finally, we have a software platform. It's mbquip.com. It gives access to the critical access hospitals to display their data and to be able to access information. And so those are the main things that we're doing under Flex with the quality improvement section. And I'm going to hand it back over to Sarah Anderson to talk about the finance and operations for the critical access hospitals.
Thank you so much, Stephanie. And one thing that I wanted to mention that I didn't earlier is within the Flex grant, there are required areas of focus and there are optional areas of focus. And for that grant, quality improvement and finance and operations are required. And population health and EMS support are optional, but we provide all of those. In addition to helping critical access hospitals rather, that are interested in changing to critical access hospital status to do that conversion. And the other thing I wanted to mention is that all of these activities are put together based on needs assessments that we do with all the hospitals and clinics before we write a 5-year plan. So hopefully this is reflective of the needs that you identified back in 2023 when we wrote this competitive grant. Okay, so as Stephanie mentioned, I'm going to talk about financial and operational improvements, which falls into two categories. One is for critical access hospitals, and the other is for rural health clinics. So I'm going to focus on the critical access hospital side of things, which I'm responsible for. And Rondi Ann will talk about the rural health clinics, which she's responsible for. So within this piece, I already mentioned that we assist hospitals in converting to critical access hospital status. We have 25 critical access hospitals, as I mentioned earlier, in the state. There's one that's currently working on a conversion, and I think that may be the last one that's eligible in the state of Oregon. So as I mentioned, we do needs assessments, and part of that needs assessment includes rural listening sessions. So last year in 2024, we conducted rural listening sessions in 6 regions across the state, rural regions across the state, and invited hospitals, public health, EMS, community-based organizations, clinics, etc., to come and talk about the largest challenges to healthcare in rural Oregon and what potential solutions exist to those. Sarah just put a link in the chat. The resulting report is available now. We published it recently. And it was really great to get out and do another needs assessment so that we can make sure that our programs are reflective of the needs of rural communities across the state. We also provide scholarships to the National Rural Health Association or the Center for Rural Health Leaderships. Uh, very large line of certification training. So they have trainings for rural CEOs, CFOs, CNOs, RNs, HR, and Board of Trustees. And so those are programs that generally begin once a year. And we put out notices to have folks apply for those scholarships. They're really, really great programs. And going into this next year, which starts September 1st, we'll be able to offer some more of those scholarships. So please be on the lookout for that. We monitor the financial and service line data for all of the critical access hospitals to make sure that we're there when hospitals have operational or financial concerns. And we do that on a quarterly basis. We build programming around finance and operational improvement as well. Over the past 4 years, we've provided a webinar series in conjunction with Wintergreen, focused on finance and operational improvement, things like how to improve your revenue cycle, what kinds of lines of service should you consider adding within a hospital, for example. And this year, we are putting together that webinar series with Whipfly, which is located in Seattle. So please be on the lookout for information about those webinars coming up. We're also working on putting together a board of directors on-demand training to help critical access hospital board members orient to what kinds of things they need to pay attention to, their responsibilities, et cetera. And one of the other things that we have launched this year, leaning into the Oregon CAH Quality Network, we really find that peer group meetings in a safe place where the agenda is really developed by the group that's meeting is really valuable, not only to that group, but to us in terms of guiding how we can support hospitals and clinics. And so we have developed out a CEO peer network that meets monthly. We're starting a CNO peer network in August. And then a CFO network is also going to be developed and starting in the new year or the next year, which would be September for us. And then finally, we provide technical assistance on an ad hoc basis. So if you have compliance questions, questions about rules and regulations, need direction on finding a consultant or a vendor that can help you with something, you can always reach out to us and we'll help you navigate that. I want to touch really quickly on the data and analysis that we provide. Emerson Ong is our data specialist. at the Office of Rural Health. And so we monitor and provide data and maps related to rural health for the state of Oregon. We produce our Areas of Unmet Healthcare Needs report, which ranks Oregon's 109 primary care service areas according to access to care from the perspective of primary care, behavioral health, and dental care, as well as the adequacy of prenatal care and avoidable emergency room visits. We also are able to create service area profiles at the zip code level, which provide insights into demographics and a healthcare market, which can be used for grant writing as well as looking at the market share of an area. We also create reports from qualitative and quantitative data and can do so also on an ad hoc basis. So the one report that we regularly create is our listening session reports, which I talked about a little earlier. Let's see, I think that's all I wanted to say on that particular slide. So I'm going to turn it over now to Ron Deanne to discuss the rural health clinic programs we offer as part of the finance and operations piece.
The RHC program, a cornerstone of rural healthcare system, was established in 19. Orchid Health McKenzie River Clinic in Blue River proudly holds the title of the first RHC in Oregon. Today, we stand strong at 97 RHCs in the state, 50 of which are provider-based rural health clinics, and 47 are independent. The Office of Rural Health Support Program aims to contribute to the success of RHC. Programming includes RHC Regulatory Compliance Program. Understanding the RHC conditions of certification empowers clinics to navigate the certification process effectively and efficiently. This year marks the 5th iteration of the Office of Rural Health RHC Compliance Cohort, which remains the most requested activity for RHCs. The cohort was established to assist clinics and sustaining a comprehensive regulatory compliance program within their clinics. The overarching goal is for each clinic to establish a compliance self-check program that adequately prepares them for recertification. Throughout the program, the Office of Rural Health engages subject matter experts to provide education on the conditions for certification, as well as tools, checklists, and opportunities for. The virtual meetings are held monthly for an hour from August through June, culminating in a final in-person meeting at a central location within the state. By the conclusion of the cohort, each clinic leader will have a finalized PDSA cycle and completed a performance improvement project with one-on-one coaching by Tressa Sacre with Health Service Associates. The next cohort begins in August. RHC program. Mock surveys are offered free to clinics in Oregon and involve a thorough evaluation of all clinic areas, a review of existing policies and procedures, and a written includes recommended improvements. They are designed to stimulate the process of a real initial certification and recertification survey conducted by state and federal agencies. These pinpoint areas that does not meet regulatory standards, boost staff confidence, and familiarize staff with the survey process and their roles, increasing their comfort level during the actual survey. Ensuring readiness to help the clinics be fully prepared for the official survey, potentially reducing the risk of negative findings or delays in certification. Please contact me if you would like to request a mock survey. I have also included the RHC pre-inspection practice tool for internal use in your RHC. RHC track at the annual Oregon Rural Health Conference. Every October, the Office of Rural Health hosts an RHC education track at the conference. The track offers leaders of the clinic and learn from RHC experts. The topics for this year's sessions will cover compliance, billing and coding, reimbursements, updates, and more. I've included the conference page for more information in the slides. Next slide. 101 cohort. This cohort will meet monthly via a live interactive webinar from January to June 2026. The course is designed to equip healthcare professionals working in RHCs with essential knowledge and skills to enhance the quality of care provided to their clinics. Susan Runyon of Runyon Healthcare Quality Consulting lead the cohort. She will provide PDSA cycle methodology and one-on and technical assistance teams identify barriers to the patient experience and implement projects or workflows to improve the overall patient journey in an RHC. A few examples of the past QI projects include review the care transition process for opportunities, care transition process, reduce no-call, no-show appointments, and there's so many more. Oregon RHC Financial Benchmarking and Analysis Training. Ralph Llewellyn, CPA from Ide Bailey, will work with the RHCs to share and compare cost report data, discuss common inefficiencies, and work to build state practices with Oregon RHCs. I've included the registration link in the slides for more information. RHC Financial Health Winter Learning Series. A new activity the Office of Rural Health will offer requested by Oregon RHC leaders. This 5-part learning series is designed to boost expertise in RHC finance and operations. It will be held by Patty Harper, an industry expert, and is tailored to strengthen accuracy, improve compliance, and increase confidence in revenue cycle practices. This series provides practical tools and timely updates to keep skills sharp in the healthcare landscape. The series webinars include fee schedule, maintenance and methodologies, RHC coding and billing update, telehealth tune-up for RHCs, and strategies for implementing and enhancing integrated behavioral health services. And on to the last page. Professional development scholarships. Rural health, as we all know, comes with unique challenges. Limited resources, workforce shortages, and the constant need to adapt to evolving healthcare demand. Rural Health offers professional development scholarships designed to empower RHC leaders with the tools and knowledge to navigate the complexities and thrive. This year, the Office of Rural Professional Development Scholarships to Oregon RHC leaders. We offered 4 Oregon Healthcare Leader Association memberships, and that included scholarships to the annual conference, 8 Certified Rural Health Clinic Professional Course Scholarships, 5 National Association of Rural Health Clinic Spring Institute Scholarships, and 12 Annual Oregon Rural Health Conference Scholarships that will be coming up in October. Webinars. Educational webinars are offered to RHC throughout the year. Past webinars include RHC Advanced Coding and Billing, Chronic Care Management, and more. The webinars can be found on the Office of Rural Health website under RHC programs. Slides. Please be on the lookout for the upcoming webinars. New and another request by Oregon RHC leaders on training webinars for RHC staff. The first, working in an RHC. This recording will provide rural health clinic staff with a comprehensive overview of the unique aspects of working in an RHC and examine the impact of the program on daily operations. This webinar at new employees or can be used as an annual review for RHC staff. Second, a manager's introduction to the RHC. This recording is designed to equip new managers understanding of the various complexities involved in effectively managing a RHC. RHC network calls. The RHC specific network calls bring leaders together to share ideas and foster connections. The sessions are held quarterly. They're informal, without a moderator or set agenda, and they will not be recorded. But RHC newsletter. This RHC specific newsletter is emailed every other Tuesday and covers the latest RHC news. updates, courses, webinars, and funding opportunities. Please see the link in the slides to subscribe. And finally, technical assistance. Office of Rural Health provides support to RHCs to improve the quality and financial viability of care in rural communities. This assistance can include tools, direct support, resource sharing, helping RHCs navigate regulatory requirements, and more. Thank you, and please email or call me if you have questions regarding the RHC program or any of these activities. And I'll turn it over to Stefa.
Awesome. Thank you, Rondianne. Hi, everyone. I'm Stefa Dragoon. I'm the Rural Population Health Program Manager, and I'm jumping in to tell you about a few programs that I manage and give some updates. So first, this year we had the second annual Forum on Rural Population Health. In the prior, I think 7 years, we had the Forum on Aging in Rural Oregon, and we transitioned into becoming the Forum on Rural Population Health last year with a virtual conference. And then this year in May, we hosted the conference in person in Seaside, and it was a lot of fun. It went really well. We had a great agenda. I know a few folks here were present, and next year I want to give a quick plug for the upcoming forum, which will again be virtual in May of 2026. We're planning on then transitioning into in-person again the following year. So please save the date. We'll be releasing a request for presentation proposals in November. We really prioritize highlighting awesome programs around the state. So if your organization or you know if someone wants to present on a program that you're doing or a strategy that you're facilitating in your organization to promote community health, population health, I would definitely encourage you to submit a presentation proposal once that opens in November. We also are in the second year of the Rural Population Health Incubator Program, which is a mini grant program to support population health programs around the state. We recently awarded 13 grants, which was really exciting. We fund these mini grants through some of the funding sources that Sarah mentioned earlier, like the Medicare Rural Hospital Flexibility Program, or FLEX, that supports our office, as well as the state office of the SOAR. The SOAR grant that she mentioned as well. And we're really grateful for the Roundhouse Foundation's partnership. The Roundhouse Foundation has supported several grants in each cycle as well. We will begin soliciting grantee proposals in next year. The dates are TBD. They will be released the next month or two. We also have a pretty large focus on community health worker programs at our office. Currently, we have funding to support 24 community health worker trainings for folks who are employed at rural hospitals, clinics, or public health. So if you have someone who might make a great community health worker, I definitely recommend applying for a spot in this program. These trainings are done virtually through NEON's training program, which is either kind of like a 6 weeks or maybe 2 months, depending on the program. So definitely check that out. We also host a Rural Community Health Worker Network. Currently, we have over 150 members. So this is a two-way listserv where anyone can send out information pertaining to community health workers to reach folks across the state. It's been a really great way to send out resources, educational opportunities, and other sorts of information to community health workers to help support their work. So I think Sarah put the community health worker kind of main page where you can find all these programs. We also support community health workers by hosting a monthly rural peer meetup where it's facilitated by me, by our office, but we really leave it up to community health workers to determine what really they want to talk about, what would be useful for them. We have had speakers come in and share information, but really we want to host the space to bring folks together to be able to make connections and provide resources and support to one another. And the last thing I wanted to plug for you all today is the Oregon Rural Health Resource Hub, which is a newer program that we launched this year. It's basically a database where anyone can submit resources that you are offering in a rural health context or that you have found especially valuable, or events that you're hosting, or really a wide range of resources that pertains to rural health in Oregon. And we post a lot of our resources. We encourage other folks to post resources as well. And then you can go in and look and see what is out there for folks working in rural health across the state. So this is something we're still building out and getting the word out about. It really already has a lot of great information. We have funding opportunities, events, educational opportunities. We have community health worker specific resources. We have a section for data and research. So definitely check that out. There's lots of ways to sort the information if you're looking for something specific. If you have any ideas for tailoring it even more to fit your needs, definitely let me know. Sarah put in the chat the main kind of homepage for it, and then you can click the Access the Hub link, which will take you to the database itself. And then if you want to submit resources to the hub, you can click that Submit Resources to the Hub link, and it'll take you to a form, and it'll submit the form and goes directly into the hub. So definitely recommend folks using that. I think it's a really cool tool and awesome. Thank you, Anne. And yeah, take a look and let us know what you think. And that's all I have.
Thank you,
Thanks.
Steffa. Thank you, Steffa, Stephanie, and Rondianne. I know we shared a lot of information with you all, but we're going to open it up now for questions, discussion, feedback that you have for us. And then I'm going to leave this up for just a moment. This has all of our information, including Emerson Ong, who's our data and GIS analyst, who I mentioned earlier, on the slide in case you want to jot down any email addresses. But feel free to put your questions in the chat. Feel free to raise your hand and unmute if you want to ask your question live. And what I'm going to do is stop sharing in just a moment so we can have a conversation. All right, any questions folks have? I know we just threw a lot at you all. Stephanie's smiling because she's so very uncomfortable with silence. She wants to talk. Thank you, Cecilia. Cecilia says no question, but the CHW peer meetup and the resource hub have been amazing, especially with being new. And that's really great feedback. Thank you for that, Cecilia. You know, we're really here to serve you all and to serve your needs, and want to make sure that we're providing information and resources that help all of you in your work. Okay, well, since there aren't any other questions, I will go ahead and close us out for the day. I really want to thank you all for listening to what we have to offer through our field services team, and hope to see you at the next community conversations. Oh, do we have a question, Misty?
Hi, my name is Misty Morningstar, and I'm a nurse. I live down in Glendale, Oregon. And I was wondering, is there any sort of from Roseburg and Grants Pass? I constantly hear, we're too understaffed to do anything in Glendale. And I wondered at the state level or any level, are there any programs to scholarship a provider for our little town?
I will definitely have you connect with Bill Funder. He's part of our workforce incentive team, and he and his team can definitely answer that question for you. I'm going to put Bill's email address in the chat here in just a moment. And he'll be presenting on that next webinar in September too. So that'll be a good place to learn about things. So I'm going to add that right now. Thank you for your question.
Thank you.
Yeah. Yeah, so in addition to the programs that we offer, we have workforce services. So we have recruitment and retention services. We have a full-time recruiter on staff, and then we manage the state loan incentive programs as well and tax credit programs. So there are several different options, I think. One other thing I was remiss to announce earlier is that tomorrow, with all of the policy changes that have been going on at the federal level, we started policy updates several months ago and did them on a biweekly basis. We're moving to monthly, but our first monthly policy update is tomorrow at noon. And I will pull up a link to register for that. What we're going to focus on tomorrow is part of the bill HR1 that passed. There's the Rural Health Transformation Fund, the $50 billion that's going to be divided out among the states. And so we're going to be talking about that tomorrow as well. Let me grab that link though.
I'm sorry, I already put it in the chat.
Thank you,
So
Steph.
so now I got it doubled. Sorry.
Thank you so much. Appreciate that. All right, any other questions? Okay, now I'll close us out. Thank you so much for your attention today. Let us know if there's anything we can do for you. We're here for all of you. So thanks again. Really appreciate it. And hope to see you maybe tomorrow at the policy update or in September at our next community conversations. Bye.
Hi, everyone. Thank you.
Thank you.